You think you know hospital codes because you've heard about Code Blue and Code Red, but hospitals have dozens more codes revealing hidden emergencies, system failures, and near-death situations that happen constantly but get buried in medical shorthand that families never understand. Most hospitals don't publicize these codes. They're internal protocols, whispered over intercoms in language only staff understands, representing crises happening right now that you'd be horrified to know about if you understood what the announcements actually meant. Code sepsis means an infection has spread to the bloodstream and organs are failing. When called, the protocol is aggressive. Blood cultures drawn, broad-spectrum antibiotics started within the first hour, IV fluids pushed rapidly. Here's what hospitals don't tell you. Sepsis kills one person every 2 to 3 seconds globally. Most sepsis cases started as something simple, a urinary tract infection, a surgical site infection, that wasn't caught early enough. By the time code sepsis is called, the patient is already critically ill. Survival rates are 30 to 40% even with aggressive treatment. Every hour matters. Code stroke means a stroke is happening right now. The neurologist and neuroradiologist are paged stat. CT scan is performed immediately to determine if it's a blockage or bleed. If it's a blockage caught within 3 to 4 hours, the patient gets TPA, a clot-busting drug that's risky but life-saving. After 4.5 hours, the window closes. The damage is done. Every minute a stroke goes untreated, 1.9 million brain cells die. Code STEMI means the worst type of heart attack, ST elevation myocardial infarction. The goal is door-to-balloon time under 90 minutes. The cardiac cath lab mobilizes immediately. Every minute in a heart attack, more heart muscle dies. By 90 minutes, significant damage has occurred. That's why code STEMI responses are so urgent. Code anaphylaxis means severe allergic reaction. The patient's airway is swelling, blood pressure is crashing, breathing is becoming impossible. Epinephrine is given immediately into the muscle. This is one of the few medications where every second of delay matters. The patient might die within minutes if epinephrine isn't given. Here's what's terrifying. Sometimes patients have epinephrine auto-injectors at home, but don't use them quickly enough. They wait, hoping the reaction will pass. By the time they get to the hospital, their airway is too swollen to intubate. Some die from anaphylaxis despite being minutes from a hospital. If you're learning what really happens behind hospital walls during codes most people don't know exist, hit subscribe. We're exposing the hidden emergencies that happen every single day. Code rapid response means a patient is declining and staff are worried they're about to crash. A rapid response team evaluates before full cardiac arrest. The idea is catching deterioration early and intervening before it becomes code blue. Those few minutes can mean the difference between survival with good neurological function and survival with severe brain damage. Code trauma means a major trauma patient is arriving or has arrived. The trauma team assembles surgeon, nurses, anesthesia, OR staff. This code is about speed. The trauma surgeon assesses while the patient is being moved. Every second counts. Many trauma patients die in the OR not from surgery, but from injuries incompatible with life. Code hemorrhage or code bleed means uncontrolled bleeding. Internal bleeding from an ulcer, external bleeding from a wound, bleeding after surgery that won't stop. When this code is called, blood is being typed and crossed for transfusion. Multiple units are ordered. The source of bleeding must be found and stopped immediately or the patient bleeds to death. Here's what hospitals don't advertise. Massive transfusions can be as dangerous as the bleeding itself. Blood transfusions carry risks, infections, immune reactions, fluid overload. But dying from blood loss is worse than the risks of transfusion. Code Lavender means a patient is actively dying, and the focus shifts to comfort instead of life-saving. The ventilator is turned off. Medications sustaining life are stopped. The patient is given pain and anti-anxiety medications. Family is called to say goodbye. Hospitals don't prepare families adequately for this shift from aggressive care to comfort care. Families sometimes feel they're abandoning their loved one when actually they're allowing a dignified death. Code respiratory failure means the patient's oxygen level is critically low. They're suffocating. The response is immediate. Increase oxygen, check the airway, consider intubation. If not already intubated, intubation happens now. The fear patients experience during respiratory failure is profound and terrifying. Code medication error means something went wrong with medication administration. Wrong patient, wrong dose, allergic reaction. When serious errors are caught, they must be reported and the patient monitored. Studies show medication errors happen in up to 10 to 15% of hospital admissions. Most cause no harm because pharmacists and nurses catch them, but some slip through, and those can be devastating. Code equipment failure means critical equipment has malfunctioned. A ventilator stops, a monitor loses power, a pump fails. A patient on a ventilator whose ventilator fails must have a bag valve mask ready immediately, or they'll suffocate. Here's what's infuriating. Hospitals often don't maintain equipment adequately. Backup equipment doesn't exist. A patient needing the only working ventilator is at mercy of equipment reliability. Code communicable disease means a serious infectious disease is present. COVID, measles, tuberculosis. Isolation protocols activate. Staff wear protective equipment. Special wards are designated. This code became extremely familiar during COVID when half the hospital was in isolation protocols. Patients couldn't see family. Staff got sick. Some died. Code overdose or code tox means a patient has been poisoned. Drug overdose, medication overdose, chemical poisoning. The focus is identifying what was taken, how much, when. Treatment depends on the substance. Some overdoses require specific antidotes. Naloxone for opioids, flumazenil for benzodiazepines, fomepizole for antifreeze. Other overdoses require supportive care, breathing support, fluids, monitoring. Overdoses are becoming more common as opioid abuse continues. Here's the reality. Most overdose patients survive if they get to the hospital quickly. Some don't want to be saved. Some can't be saved because the dose was too high or the substance was too toxic. Code ICU admission means a patient needs to move to ICU immediately because they're too sick for a regular floor. The problem is beds. If the ICU is full, where do you put the patient? Sometimes a patient on a regular floor is discharged prematurely to make room. Sometimes patients wait hours for an ICU bed. Bed availability determines quality of care. Code AMA, against medical advice, means a patient is leaving before the medical team thinks they're ready. Patients have the right to leave. Hospitals document AMA to protect themselves legally. But what if the discharge happened because insurance stopped paying? The AMA discharge can be a convenient way for hospitals to discharge patients they can't afford to keep. What hospitals never fully explain about these codes is that they're happening constantly. While you're waiting, code sepsis is called. While you're being admitted, code stroke is being managed. These codes represent the reality of hospital operations: constant crisis, constant intervention, constant life and death decisions that families never see. Understanding hospital codes means understanding that hospitals are crisis management institutions. Every code represents someone's worst day. The codes you've heard of are only the beginning. The codes you've never heard of are happening right now in hospitals across the country, representing hidden emergencies, system failures, infections, and deteriorations that staff manage with precision born from repetition and necessity. The next time you're in a hospital and hear an announcement you don't understand, listen closely. Someone's life is probably hanging in the balance, and healthcare workers are responding with urgency designed to save it.